Alaikum. Welcome in my YouTube live. How are you? I hope all you are very good. I'm very happy. All peoples welcome in my live. My dear doctors, my friends, my students, my colleague, scientists, researchers, physicians, scholars, medical. Let's start to the topic. Today we will discuss about skeleton. Today's topic is about skeleton. It is said one quarter of what you eat keeps you alive. The three quarters keeps doctors alive. It is a joke. Skeleton include bones and cartilage. It forms the main supporting framework of the body and is primarily designed for a more effective production of movements by the attached muscles. We discuss about bones. Bones has different names, synonyms. Number one, os and Latin language. Number two, osteon and Greek language. Compare with the terms osteology, ossification, osteomyelitis, osteomalacia, osteoma, osteotomy, etc. What is bone's definition? Bone is one third connective tissue. It is impregnated with calcium salts, which constitute the remaining two-thirds part. The inorganic calcium salts, mainly calcium phosphate, partially calcium carbonate, and traces of other salts, made it hard and rigid, which can afford resistance to compressive forces of weight bearing and impact forces of jumping. The organic connective tissue collagen fibers made it tough and resilient, mean flexible, which can afford resistance to tensile forces in strength. Bone is comparable to iron and steel. The inorganic calcium salt is calcium hydroxyapatite, calcium 10, PO4, 6, hydroxyl OH 2. If it is removed by putting the bone in acid, it becomes flexible and can be tiled as a knock. If organic tissue is removed by burning, the bone crumbles into small pieces. Division of the skeletal system. Regions of the skeleton, number of bones, cranial and facial bones, mnemonic is A to Z. Exoskeleton, skull, cranium, and the skull, cranium, 8 bones, face, 14 bones, hyoid, 1 bone. Auditory ossicles, 3 and each other. Auditory ossicles, 3 and each ear, total 6. Malleus, incus, stapes. Vertebral column, 26. Thorax and the thorax, sternum, 1 bone, ribs, 24. Appendicular skeleton, pectoral, shoulder girdles. Include clavicle, 2 bones, scapula, 2 bones, upper extremities, humerus, 2 bones, ulna, 2 bones, radius, 2 bones, carpals, 16 bone, metacarpals, 10 bone, phalanges, 28, pelvic, hip girdle, pelvic or hip bones, 2, lower extremities, femur, 2 bones, fibula, 2 bones, tibia, 2 bones, patella, 2 bones, tarsus, 14, 14 bone, metatarsus, 10 bones, phalanges, 28 bones. Total, these are 206 bones. Cranial and facial bones, mnemoid neck is A to Z. Ethmoid, 1 bone, frontal, 1 bone, inferior nasal concha, 2 bones. lacrimal 2 bones, maxilla 2 bones, mandible 1, nasal 2 bones, occipital 1, palatal 2 bones, palatine 2 bones, sphenoid 1 bone, temporal 2 bones, vomer 1 bone, zygomatic 2 bones. Despite its hardness and high calcium content, the bone is very much a living tissue. It is highly vascular with a constant turnover of its calcium content. It shows a characteristic pattern of growth. It is subjected to disease and heals after a fracture. It has greater regenerative power than any other tissue of the body, except blood. It can mold itself according to changing and stress and stand and strain it bears. It shows disuse atrophy and overuse hypertrophy. What are the function of bones? Number one, bones gives shape and support to the body and resist any forms of stress. These number two, these provide surface for the attachment of muscles, tendons, ligaments, etc. Number three, these serves these serve as levers for muscular actions. Number four, the skull, vertebral column, and thoracic cage protect brain, spinal cord, and thoracic and some abdominal viscera, respectively. Bone marrow, number five, bone marrow manufactures blood cells. Bones store 97% of the body calcium and phosphorus. Bone marrow contains reticuloendothelial cells, which are phagocytic in nature and take part in immune response of the body. Number 8, the larger paranasal air sinuses, for example, ethmoidal sinuses, affect the timbre of the voice. Classification of bones. We classify bones in different category. Welcome MD Wycott on my live. Yes, hi. Number one, according to shape, bones classification. Number one, long bones. Each long bone has an elongated shaft. It is called diaphysis. And two expanded ends. It is called epiphysis, which are smooth and articular. The shaft typically has three surfaces separated by three borders: a central medullary cavity and a nutrient foramen, directed away from the growing end. Examples number one. Typical long bones. These are humerus, radius, ulna, femur, tibia, and fibula, with two secondary epiphyses. Number 2, miniature or short long bones have only one epiphysis like metacarpals and phalanges. Number 3, modified long bones have no medullary cavity like clavicle. Short bones, their shape is usually cuboid like a cube or scaphoid, boot shaped. Examples, dorsal and carpal bones. Flat bones resemble shallow plates and form boundaries of certain body cavities. Examples are bones and the vault of the skull, sternum, ribs, and scapula. These are examples. Irregular bones, examples, hip bone and bones in the base of the skull. For example, sphenoid and first and second cervical vertebra. Number 5, pseudo parametric bones. Certain irregular bones contain large air space lined by epithelium. Examples are maxilla sphenoid bone. Ethmoidal etc. They make the skull a light in weight, help in resonance of voice, and act as air conditioning chambers for the inspired air. Number 6, sesamoid bones. These are bony nodules found embedded in the tendons or joint capsules. They have no periosteum and ossify after birth. They are related to an articular or non-articular bony surface, and the surface of contact or covered with hyaline cartilage and lubricated by a bursa or synovial membrane. Examples are patella and the tendon of quadriceps femoris pisiform and the tendon of flexor carpi ulnaris, fibula and the tendon of lateral head of gesto, gastrocnemius, rider's bone developed in tendon of adductor longus and professional riders. Functions of the sesamoid bones. Number 1, to resist pressure. Number 2, to minimize friction. Number 3, to alter the direction of pull of the muscles. And number 4, to maintain the local circulation. Accessory supernumerary bones are not always present. These may occur as ununulated epiphytes developed from extra centers of ossification. For example, sutural bones of the skull, cervical ribs, lumbar ribs. The sutural Wormian bone is mostly seen in the region of lambda. This can be present at Asterian and Poterian as well. Such bones are common in hydrocephalic skulls. And medico-legal practice, accessory bones may be mistaken for fractures. However, these are often bilateral and have smooth surfaces without any callus. Developmental classification: membrane dermal bones ossify in membrane, intramembranous, or endochondral ossification and are thus derived from replacement of performed cartilaginous models. Examples are bones of limbs like humerus, femur, vertebral column, and thoracic cage. Membranocartilaginous bones ossify partially in membrane and partially in cartilage. Examples are clavicle, sternal, and ossifies by endochondral ossification, while the rest of the bone ossifies by intramembranous ossification. Mandible, occipital, temporal, sphenoid bone are the example of this category. Somatic bones, most of the bones are somatic. Visceral bones, these are a few and develop from pharyngeal arches. Examples are hyoid bone, part of mandible, and ear ossicles. Regional classification: axial skeleton, appendicular skeleton. Axial skeleton include skull, vertebral column, and thoracic cage. Number two, appendicular skeleton includes bones of the limbs, for example, pectoral girdle, free upper limbs, and pelvic girdle, free lower limbs. Structural classification. Number one, macro macroscopically, the architecture of the architecture of bone may be compact or cancellous. Number one, compact bone is dense and texture like ivory but is extremely porous It is best developed in the cortex of the long bones. This is an adaptation to bending and twisting forces, a combination of compression, tension, and shear. Cancellous or saphengy or trabecular bone is open in texture and is made up of a meshwork of trabecular rows and plates, between which are marrow containing spaces. The trabecular meshworks are of three primary types: meshwork of rods, number 2, meshwork of rods and plates, number 3, meshwork of plates. Cancellous bone is an adaptation to compressive forces. Bones are marvelously constructed to combine strength, elasticity, and lightness in weight. 2. The architecture of bone may be modified by mechanical forces. The form of the bone is primarily determined by heredity. According to Wolff's law, trajectory theory of Wolff 1892, the bones formation is directly proportional to stress and strain. There are two forces: tensile force and compressive force. Both the tensile and compressive forces can stimulate bone formation in proper conditions. The architecture of calcaneus bone is often interpreted in terms of the trajectorial theory. Thus, the arrangement of bony trabecular lamella is governed by the lines of mesial internal stress and the bone. Pressure lamellae are arranged parallel to the line of weight transmission, whereas tension tension lamellae are arranged at right. I hope you are understand what is going on. Comparison of compact and cancellous bones. Location: compact bone is in shape diaphysis of long bones, while cancellous spongy bones is the present in the epiphyse of long bones. Lamellae: compact bones arranged to form version system, while cancellous spongy bone arranged in a meshwork, so eversion system are not present. Bone marrow. Compact bone yellow, which stores fat after puberty. It is red before puberty. While cancellous spongy bones, red, produce RBCs, granular series of WBC and platelets. Nature. Compact, compact bone is hard and ivory-like, while the spongy bone is spongy in nature. The compact arrangement of pressure lamella forms bony butters for additional support like calcal femorli. Microscopically, the bone is of five types, namely lamellar, including both compact, compact and cancellous, woven, fibrous, dentine, and cement. Number one, lamellar bone. Most of the mature human bones, whether compact, compact or cancellous, are composed of thin plates of bony tissue called lamellae. They are arranged and as these are arranged as branches, curved plates and the cancellous bones, but in concentrated cylindrical harvest Haversian system or secondary osteos in a compact bone. Woven bones seen in fetter bone fracture repair and in cancer of bone. The collagen fibers and bone crystals are arranged randomly. Fibrous bone is found in young fetal bones but are commonly in reptiles and amphibia. Dentine and similar occur in teeth. Dentines and cement bones occur in teeth. Naked eye examination of the longitudinal and transverse sections of a long bone shows the following features. Number one, shaft. Number two, cortex. And number three, medullary cavity is lined by endosteum. Endosteum. Number one, shaft. Shaft from without inwards. It is composed of periosteum, cortex, and medullary cavity. Periosteum is a thick, fibrous membrane covering the surface of the bone. It is made up of an outer fibrous layer and intracellular layer, which is osteogenic and is united to Sharpie's fibers, and the union is particularly strong over the attachment of tendons and ligaments. At the articular margin, the periosteum is continuous with the capsule of the joint. The abundant periosteal arteries nourish the outer part of the underlying cortex also. Periosteum has a rich nerve supply which makes it the most sensitive part of the bone. Number two, cortex is made up of a compact bone which gives it the desired desired strength to withstand all possible mechanical strains. Number three, medullary cavity is lined by endosteum, osteoblasts, and endosteum help and bone repair and remodeling of bones. The medullary cavity is filled with red or yellow bone marrow at birth. The marrow is red everywhere with widespread active hemopoiesis. As the age advances, the red marrow at many places atrophies and is replaced by yellow fatty marrow, fatty marrow with no power of hemopoiesis. Red marrow persists, and the cancellous ends of long bones, sternum, ribs, iliac crest, vertebrae, and skull bones throughout life. The sites of bone marrow in adult are the two ends of a long bones are made up of cancellous bone covered with hyaline mean articular cartilage. Parts of a young growing bone. Three. There are four parts of a young bones. Number one, epiphysis. Number two, diaphysis. Number three, metaphysis. Number four, epiphyseal plates. A typical long bone ossif- ossifies in three parts. Number one, the two ends from secondary centers. ossification center appearing after birth, and the intervening shift from a primary center ossification center appearing before birth. Before ossification is complete, the following parts of the bones can be defined. Number 1. Epiphysis. The ends and tips of a bone which ossify from secondary centers are called epiphyses. These are of the following types. Number 1. Pressure epiphysis. It is articular and takes part in transmission of the weight. Examples: head of humerus, lower end of radius, etc. Number 2. Friction epiphysis. It is non-articular and does not take part in the transmission of the weight. It always provides attachment to one or more tendons, which result a traction on the epiphysis. The traction epiphysis ossify later than the pressure epiphysis. For example, trochanter's of femur and tubercles of humerus bone. Number 3. Etastic epiphysis. It is phylogenitally an independent bone which as man becomes fused to another bones. For example, coracoid process of scapula and osteotrigonum or lateral tubercle of posterior process of aberrant epiphysis. It is not always present. Examples: epiphysis at the head of the first metacarpal and at the bases of other metacarpal bones. Diaphysis. Before we discuss about epiphysis, the next is diaphysis. It is the elongated shaft of a long bone which ossifies from a primary center of ossification. Number 3. Metaphysis. Epiphysis, diaphysis, metaphysis. The epiphyseal ends of a diaphysis are called metaphysis. The epiphyseal ends of a diaphysis are called metaphysis. Each metaphysis is the zone of active growth before epiphyseal fusion. The metaphysis is richly supplied with blood through and arteries forming hairpin bends. Thus, metaphysis is the common site of osteomyelitis in children because the bacteria or emboli are easily trapped in the hairpin bends, causing infarction. After the epiphyseal fusion, vascular communications are established between the metaphyseal and epiphyseal arteries. Now the metaphysis contains no more end arteries and is no longer subjected to osteomyelitis. Number 4, epiphyseal plate of cartilage. Epiphyseal plate separates epiphysis from metaphysis. Proliferation of cells in this cartilaginous plate is responsible for lengthwise growth of a long bone. After the epiphyseal fusion, the bone can no longer grow in length. The growth cartilage is nourished by both the epiphyseal and metaphyseal arteries. Blood supply of bones. Arterial supply, nutrients, arterial supply. Number 1. Young long bones. The arterial supply of a long bone is derived from the following sources. Number 1. Nutrient artery. It enters the shaft through the nutrient foramen, runs through the cortex, and divides into ascending and descending branches in the medullary cavity. Each branch divides into a number of small parallel channels which terminate in the adult metaphysis by anastomosing, with the epiphyseal, metaphyseal, and periosteal arteries. The nutrient artery supplies medullary cavity, inner two-thirds of cortex, and metaphysis. The growing ends of bones in upper limb or upper end of humerus and lower ends of radius and ulna. In lower limbs, the lower end of femur and upper end of tibia are the growing ends. The nutrient foramen is directed away from the growing end of the bones. Their directions are indicated by a jingle. To the elbow, I, I go; from the knee, I flee. The details and variations and the diaphyseal nutrient foramina are described by a number of authors. Ujjwal 1962, Mysorekar 1967, Chhatrapati and Misra, 1967, KT 1971, Pateki and Mysore, 1977, Mysore and Nandi Nandithkar, 1979, Logi, Longia et al. 1980. They describe about these things. Periosteal arteries. These are especially numerous beneath the muscular and ligamentous attachments. They ramify beneath the periosteum and enter the Volkmama's canals to supply the outer one-third of the cortex. I hope you are understanding what are going on. Epiphyseal arteries. These are derived from periarticular vascular arcadis sulculus vasculosus found on the non-articular bony surface. Out of the numerous vascular foramina in this region, only a few admit the arteries epiphyseal and metaphyseal, and the rest are venous access. The number and size of these foramina may give an idea of the relative vascularity of the two ends of a long bone tendon. Tendon 1964 described metaphyseal arteries. These are derived from the neighboring system vessels. They pass directly into the metaphysis and reinforces the metaphyseal branches from the primary nutrient artery. And miniature long bones metacarpals, the infection begins in the middle of the shaft rather than at the metaphysis. And at the metaphysis, because the nutrient artery breaks up into a plexus immediately upon reaching the medullary cavity. In the adults, however, the chances of infection are minimized because the nutrient artery is mostly replaced by the periosteal vessels. Long short bones nutrient artery enters the middle of shaft and divides it form a plexus. Periosteal artery supplies major part of bones and may replace the nutrient artery. Short bones, short bones, short bones are supplied by numerous periosteal vessels which enter their non-articular surfaces. Vertebra. In a vertebra, the body is supplied by anterior and posterior vessels and the vertebral arch by large vessels entering the base of transverse processes. Its red marrow is drained by two large basivertebral veins. These foramina lie on the posterior aspect of the body of the vertebra. Ribs. A rib is supplied by the nutrient artery which enters it just beyond the tubercle and the periosteal arteries. Venous drainage. Veins are numerous and large in the cancellous red marrow containing bones. For example, basivertebral veins and the compact bone, they accompany arteries and the Volkmann's canals. Lymphatic drainage. Lymphatic have not been demonstrated within the bone, although some of them do accompany the periosteal blood vessels which drain to the regional lymph nodes. Nerve supply of bones. Nerves accompany the blood vessels. Most of them are sympathetic and vasomotor and function. A few of them are sensory, which are distributed to the articular ends and periosteum of the long bones, to the vertebra, and to large flat bones. And ossification of bones. Bones are first laid down as mesodermal connective tissue. It is also called connective tissue. Condensations, replacement of mesodermal models into bone is called intramembranous or mesenchymal ossification, and the bones are called membrane mean dermal bones. However, mesodermal stage may pass through cartilaginous stage by chondrification during second months of intrauterine life. Replacement of cartilaginous model into bone is called intracartilaginous or endochondral ossification, and such bones are called cartilaginous bones. Ossification takes place by centers of ossifications, each one of which is a point where laying down of lamellae, bone formation, scars by the osteoblast situated on the newly formed capillary loops. The centers of ossification may be primary or secondary. The primary centers appear before birth, usually during 8th week of intrauterine life. The secondary centers appear after birth during childhood with a few exceptions of lower end of femur and upper end of tibia, which appear during 9 months of intrauterine line. Many secondary centers appear during puberty. A primary center forms diaphysis and the secondary centers form epiphysis. Fusion of epiphysis with the diaphysis starts at puberty and is complete by the age of 25 years, after which no more bone growth can take place. The law of ossification states that secondary centers of ossification which appear first or last to unite. Exception is lower end of fibula, the end of a long bone where epiphyseal fusion occurs. Later is called the growing end of the bone. Growth of a long bone. How long bone is growth? Let's see. Bone growth. Bone grows in length by multiplication of cells and the epiphyseal plate of cartilage. Bone growth. Bone grows in thickness by multiplication of cells and the deeper layer of periosteum. Bones grow by deposition of new bone on the surface and at the ends. This process of bone deposition by osteoblasts is called appositional growth or surface accretion. However, in order to maintain the shape of the unwanted bone must be removed. This process of bone removal by osteoclast is called remodeling. This is how marrow this is how marrow cavity increases in size. Factors affecting growth. Which factors affect bone growth? Let's see. Adequate adequate amounts of proteins, carbohydrates, minerals, vitamins, and hormones are necessary for proper growth of bones. Number one, which vitamins? Vitamins A controls the activity, coordination, and distribution of osteoblast and osteoclast. Lack of vitamin decreases the activity of lack of vitamins A decreases the activity of osteoclast, leading to reduction in size of cranial and spinal formation and spinal foramina. Vitamin D is necessary for the absorption of calcium and phosphorus from intestines, which help in proper ossification. Vitamin C is as every person know Vitamin C is necessary for maintenance of organic matters. Hormonal adequate, adequ- adequate amounts of growth hormone of anterior pituitary, it is also called hypophysis cerebri, para, parathormone of parathyroid gland and calcitonin of thyroid gland and also necessary. Medico-legal and anthropological aspect. When a skeleton, when a skeleton or isolated bones are received for medico-legal examination, one should be able to determine number one whether the bones are human or not. This is a main point every person should remember. Whether they belong to one or more persons. Number three, the age of the individual. Number four, the sex or gender. Number five, the stature and the time and cause of death. For excellent details, estimation of skeleton age. When as a doctor you work in the hospital, different dead bodies or just bones or completely skeleton is bring in the hospital for medical legal examination MLC. So it is doctor duty to examine carefully and note what he or she examine. Estimation of skeleton age up to the age of 25 years. The skeletal age can be estimated to within 1 to 2 years of correct age by the state of dentition and ossification, provided the whole skeleton is available. Provided the whole skeleton is available. From 25 years onwards, the skeletal age can be estimated to within plus 5 years of the correct age by the state of cranial sutures and of the bony surfaces of symphysis pubis. In general, the appearance of secondary centers and fusion of epiphyses occur about 1 year earlier in females than in males. These events are also believed to occur 1 2 years Bajaj et al. 1967 or 2 to 3 years Pillai 1963 earlier in India than in Western countries. However, Jit and Singh 1971 did not find any difference between the Eastern and Western races. Estimation of sex. Gender can be determined after the age of puberty. Gender differences are best marked in the pelvis and skull. An accurate determination of gender can be done in over 90% cases with either pelvis or skull alone. However, gender sexual dimorphism has been worked out in a number of other bones like sternum. Jit et al. 1980, Atlas Halim, Halim and Siddiqui 1976, and most of the limb bones. Estimation of stature height. It is a common experience that trunk and limbs show characteristics ratios women themselves and in comparisons with total height. Thus, a number of regression formulae have been worked out to determine height, height from the length of the individual limb bones. Sticky and Shaw, 1944, Singh and Sohal, 1952, Jit and Singh, 1956, Athawali, 1963, Kolti and Bansal, 1974, Katie and Majumdar, 1976. Height can also be determined from parts of certain long bones. Maisoretter et al. From head length, Sasina et al. 1981, and from foot measurements, Charnalia 1961, Kamra et al. 1980. crown rump (CR) length has been correlated with the physical length of fetal bones. Wari and Bensel 1977, and with the neonatal and placental parameters. Jaya Singh et al. 1980, Saxena et al. 1981. Estimation of days. It is of interest to anthropologists. A number of metrical like cranial and facial indices and non-metrical features of the skull, pelvis, and certain other bones are of racial significance. Krugman 1962, Berry 1975. They work on this. Cartilage synonymous, same name. Chondros in Greek and gristly compare with the terms chondrification, chondrodystrophy, synchondrosis, etc. What is cartilage? Cartilage is a connective tissue composite of cells, chondrocytes, and fibers, collagen or yellow elastic, embedded in a firm gel-like matrix which is rich in a mucopolysaccharide. It is much more elastic than bone. General features: cartilage has no blood vessels or lymphatics. The nutrition of cells diffuse through the matrix. Cartilage has no nerves. It is therefore insensitive. Cartilage is surrounded by a fibrous membrane called perichondrium, which is similar to periosteum in structure and function. The articular cartilage has no perichondrium, so that its regeneration after injury is inadequate. When cartilage calcifies, the chondrocytes did die and the cartilage is replaced by bone-like tissue. Let's compare bones and cartilage. Bone is red, bone is hard, cartilage is firm. Matrix has inflexible material called ossition and bones, while it has chondroitin providing flexibility and cartilage. And the bone matrix possesses calcium salt, but in cartilage calcium salts not present. Bones has rich nerve supply. It is vascular in nature. And cartilage does not have nerve supply. It is avascular in nature. Bone marrow is present in the bone, but in cartilage, bone marrow is absent. And both growth is only by opposition, by surface deposition. But in cartilage, growth is both opposition and intestine, in, interstitial from within. Types of collagen. There are three types of cartilage. Let's see types of cartilage. There are three types of cartilage. Hyaline cartilage, number one. Number two, fibrocartilage. Number three, elastic cartilage. I hope you understand what is discussed. I hope you understand. Welcome different video. Thank you for joining us. I hope all you are very well and happy in your places and taking part in the development of your country, your region, your province, your state, your city, your family, and your home. Who are new on my YouTube channel, please subscribe my channel, like my live, and for feedback, write comments, and you can ask questions on to the topic if you have any doubt about to the topic. My dear doctors, my friends, my students, my colleagues, scientists, research, physicians, scholars, medical staff, paramedical staff, my hospital medical staff, and who or know me and who not know me and who are newcomers on my YouTube channel from different countries from all over the world. Hope are you are very happy and you understand what is going on. How are how are you? I hope you are very good. How is your life going on? Where are you from? Please write in the comment what you learned today. How was your today topic? What kind of work you do? Okay, take care of yourself. Be happy always. Good night. Take rest. See you tomorrow.